Hello friends, welcome to my YouTube channel Guru Ramdas Educational Society. Today I would like to talk about brain stroke. What is brain stroke? Brain stroke is a medical condition wherein there is a death of brain cells inside the brain and that can lead to brain stroke. This was first described by Hippocrates, which is sudden paralysis due to ischemia. Martin Luther King was affected with brain stroke and he lost his speech before dying in 1546. Now, I have talked about the definition of brain stroke. Now, talking about the symptoms of brain stroke. What are the basic symptoms of brain stroke? The main symptoms of brain stroke are fast mnemonic, that is numbness, drifting of arm in downward direction, speech disorder, and tend to take to emergency. Brain stroke is an emergency condition where there can be sudden paralysis of the affected limb, there can be sudden numbness, there can be altered taste, sense, smell, hearing. There can be cognitive deficits, like there can be decreased attention, memory, concentration, etc. And patients who are affected with brain stroke, they lose the self-confidence and self-esteem to regain, because this is a very drastic condition where brain is affected and people lose hope, they become hopeless, they are accompanied by psychological and psychiatric conditions, like they can have depression, apathy, mania, panic attacks, anxiety. So these kinds of supplemental conditions can be seen in patients with brain stroke. If brain stroke is seen in brainstem means connection of pons and medulla oblongata is known as brainstem, and if there is involvement of cranial nerves, then it can show functions lost depending upon the cranial nerve affected. So there can be facial weakness, ptosis, there can be drooping of eyelids, there can be drifting of mouth on one side, there can be sticking out of tongue, there can be aphasia, apraxia, and these kinds of terms can be related to brain stroke. Now, talking about the two kinds of brain stroke, one is ischemic stroke and other is hemorrhagic stroke. Ischemic stroke means there is a blockage within the artery of the brain and that can lead to decreased blood supply to the brain, leading to ischemic stroke. Ischemic stroke can be due to thrombus, it can be due to embolus, it can be due to cerebral hypoperfusion, and it can also be due to cerebral venous sinus thrombosis. Now, talking about the thrombus can be within the large artery, like it can be within the middle cerebral artery of the brain, it can be in the circle of Willis, anterior cerebral artery, it can be posterior cerebral artery. So these kinds of ischemic stroke which are seen in large arteries can be due to ischemia. It can also be due to in small arteries. Small arteries means it can be due to in branches of middle cerebral artery, it can be due to branches of circle of Willis. So these kinds of arteries, if they are affected, they can also be referred as lacunar stroke. And if there is embolus most commonly seen in heart. Embolus means it is a disintegrated part of thrombus that is seen in elsewhere in the body and that is moving to the other part of the body. For example, it is going to the brain. It can go through internal carotids So there can be stasis of blood, and stasis of blood can be seen in cardiovascular diseases. So the most common site for cause of brain stroke can be heart. So from heart, the embolus can go into the internal carotids, and from internal carotids they can go into the brain, and it can cause blockage within the brain blood vessels, and it can lead to stroke, and that kind of stroke is known as ischemic stroke. Large vessel thrombosis can be due to underlying atherosclerotic plaque. Atherosclerotic plaque means there can be sclerosis with atheromatous formation inside the blood vessel, and in these patients we have to know the underlying cause, why there is atherosclerosis. If the cholesterol level is high, if the LDL cholesterol level is high, then that can lead to brain ischemic stroke, and ischemic stroke type is thrombotic stroke, embolic stroke. So these kinds of strokes can be seen. Atrial fibrillation in patients with embolic stroke is a very common condition, and atrial fibrillation can be a high risk cardiovascular disease. So this can be an increased risk for ischemic brain stroke. There are high risk cardiovascular disease apart from atrial fibrillation, and these can be recent myocardial infarction with low ejection fraction, congestive heart failure with low ejection fraction, sick sinus syndrome, and artificial heart valves, prosthesis. So these kinds of conditions can also result in ischemic embolic stroke. Now talking about the cerebral hypoperfusion. Cerebral hypoperfusion, when it happens, when there is low cardiac output, when the blood flow from the heart is low, and when there is cardiac arrest, the blood flow to the brain stops, and as a result of stoppage of blood in the brain, it can lead to cerebral hypoperfusion. So overall blood flow to the brain decreases, and that can lead to brain stroke. Now there are watershed areas present inside the brain. Watershed areas are those areas which get dual blood supply. For example, if there is a watershed area supplied by anterior cerebral artery, it gets blood supply from middle cerebral artery too. So these watershed areas, if they are affected, if there is ischemia between the anterior cerebral artery and middle cerebral artery, still they will get blood flow, and if this happens, so we can say that the brain functions are compromised, but they are not totally dead, and these can also be a part of ischemic stroke. Now talking about cerebral venous thrombosis. Now what is happening in cerebral venous thrombosis? Cerebral venous thrombosis means there is a thrombus within the sagittal sinuses or superior inferior confluence of sinus. If there is a thrombus inside the sinuses, that can lead to brain stroke, because when there is a thrombus inside the cerebral vein, it will increase the venous pressure, and as a result of it, vasoconstriction, the thrombus can get into the artery and it can lead to blockage. Blockage will lead to decreased blood supply, and decreased blood supply will lead to decreased brain functions. Decreased brain functions will lead to constellation of symptoms, and these constellation of symptoms will lead to brain stroke. Now, it is very important to understand the pathophysiology of brain ischemic stroke. What is the pathophysiology of ischemic stroke? When there is dead cells present inside the brain due to ischemia, due to decreased blood supply through the brain artery or brain arterial system, what is happening is the cells are switching on to anaerobic metabolism, and as a result of this anaerobic metabolism, there is more production of lactic acid. So it is also leading to lactic acidosis, it is leading to metabolic acidosis, and that is a complication of ischemic stroke. Now, when there is lactic acidosis, there are glutamate neurotransmitter, which is an excitatory neurotransmitter. What it is doing? Normally, there is an uptake of glutamate from extracellular matrix of neuron. But when there is a brain stroke, the uptake of glutamate from extracellular matrix decreases, and it binds with its NMDA receptors, and it leads to more toxicity. It leads to influx of calcium into the brain cells from their extracellular matrix, and that is leading to damage of protein, lipids, and nuclear material within the neuron. And as a result of this, the brain cells are going to die and they will become dead very soon. Now, in addition to this, the blood-brain barrier, which is a barrier which is formed by extracellular matrix components like hyaluronic acid, collagen, these are also getting destroyed because there is an activation of zinc and calcium dependent metalloproteases, which are damaging the structural integrity of blood brain barrier, and that is leading to brain stroke. Now, this was the pathology of ischemic stroke. Now, talking about the other type of stroke, which is known as hemorrhagic stroke. Hemorrhagic stroke occurs when there is a rupture of artery inside the brain. When the artery gets ruptured, breached, there is an hemorrhagic stroke. Intracerebral hemorrhage and subarachnoid hemorrhage are two types of hemorrhagic stroke. In intracerebral hemorrhage, there is a hematoma or bleeding formation seen within the cerebrum of brain. And this blood can also go into the ventricles of brain, and that can lead to intraventricular hemorrhage. Subarachnoid hemorrhage means the blood accumulates within the arachnoid membrane and pia mater, and as a result of this, it leads to hemorrhagic stroke. Now, talking about the risk factors, what are the main risk factors for brain stroke in general? High blood pressure. If the blood pressure of patient is high, then it can lead to brain stroke. It can be hemorrhagic stroke, it can be ischemic stroke. High cholesterol level can also predispose to brain stroke. Smoking, in 30% cases, whether it is active smoking or passive smoking, it can lead to brain stroke. Alcohol consumption can trigger various mechanisms. It can lead to hypertension, platelet aggregation, rebound thrombocytosis. So these types of conditions can be accompanied in alcoholic toxicity, and that can lead to brain stroke. Patients with diabetes mellitus who have high levels of sugar in their blood, and if the HbA1c is more than 6.5, they can also have high risk for brain stroke. Obesity. If a patient is very fatty and he is having lot of fat accumulated in his abdomen, in his trunk, in his thighs, so that can also lead to high risk for brain stroke, because these patients have high amount of fats and fats are not getting degraded, it is accumulating, it is leading to atherosclerosis, and atherosclerosis is a predisposing factor for brain stroke. Consumption of red meat is also related to brain stroke. Physical inactivity. Person who does not, who are bedridden patients, who cannot get out of the bed easily, who have paralysis, they cannot get out of bed easily. If they do less amount of physical activity, if they are not doing exercise properly, so that cases can have an increased risk for brain stroke, because immobilization process in these patients can result in triggering of various mechanisms that can lead to brain stroke. Patients having unhealthy diet, patients who are on unhealthy diet can also have an increased risk for brain stroke. Now talking about the last risk factor, that is cocaine and amphetamines. Cocaine and amphetamines are addictive drugs and these are CNS stimulants. CNS stimulants means they will stimulate your brain, but cocaine is also a vasoconstrictor. It will constrict the blood vessels inside the brain and that can lead to brain stroke. After talking about the risk factors for brain stroke, we are talking about the risk score, risk stratification scores. There are various risk stratification scores for brain stroke. One is Rosier score, recognition of score in emergency room. This score is used in emergency room by emergency physicians and they assess, plan the treatment based on these scores. The other score is NIHSS score. This score assesses the 11 testing abilities of the patient. That is, they test loss of consciousness, right arm, right leg, left leg, motor cortical activities, they assess the speech level. So these are assessed and treatment is planned based on NIHSS score. And this NIHSS score is also a pavement way for providing treatment planning, monitoring and surveillance. Now talking about CHAT2 DS2 VAS score. CHAT2 DS2 VAS score is also an important type of score. This is used in patients with atrial fibrillation and this score assesses whether the patients are at risk for brain stroke. C for congestive heart failure, H for hypertension if BP is more than 140/90 mm of Hg, A for age more than 65 years, D for diabetes. If patient is diabetic, then he is a high risk for brain stroke. S for history of stroke or TIA, and VASC, V for vascular artery diseases like aortic plaque, myocardial infarction or peripheral artery disease, and SC for sex category, that is female. if CHA2DS2 VAS score is high in patients with underlying atrial fibrillation, they can have a high risk for brain stroke. There is also one more score which is known as Hasbled score. Hasbled score assess the bleeding risk in patients with brain stroke. So H for hypertension, blood pressure more than 150 160 mm of Hg. A for age more than 65 years. S for stroke, that is history of stroke or TIA. Blood. B for bleeding tendencies. If there is a bleeding tendency in a patient, then we have to stop anticoagulants and antithrombolytic drugs. L for labile INR. Labile INR means if INR ratio is on high scale, then we have to stop anticoagulants because patients can have a bleeding tendency. E for elderly, age more than 75 years of age. And D for drugs. What type of drugs are taken, history of drugs is important. Now these risk stratification scores helps in treatment planning, surveillance and monitoring of patients. Now talking about the diagnosis, how to diagnose brain stroke. First modality of investigation is CT scan. CT scan is useful in diagnosis of hemorrhagic stroke when compared to ischemic stroke. The detection of ischemic stroke is difficult to diagnose by CT scan. MRI scans are also another diagnostic modality which is advanced, and patients who are brought to the hospital to the emergency room within 3.5 to 4.5 hours of onset with early recognition of symptoms, they can be treated with antithrombolytics, anticoagulants and other types of drugs in case of ischemic stroke easily. There are other types of investigation modalities like PET scan, cerebral angiography, Doppler ultrasound of carotids. So these kinds of investigations must be recommended by all kinds of physicians who are seeing patients with brain stroke. Now first management is to control the risk factors of brain stroke. All risk factors, smoking, alcohol, increased cholesterol, increased lipids, high blood pressure, asthma, diabetes mellitus, consumption of red meat, physical inactivity, unhealthy diet. So these kinds of risk factors must be controlled in order to avoid brain stroke. So which drugs has to be administered in patients with brain stroke? Aspirin should be given, clopidogrel should be given, ticlopidin should be given, dipyridamole should be given, and RTPA, recombinant tissue plasminogen activator, should be given. These drugs are given in case of ischemic type of brain stroke, not hemorrhagic type of brain stroke. Now talking about carotid endarterectomy. Carotid endarterectomy is a simple surgical procedure where carotids are explored if there is a thrombus or an embolus within the carotid artery. Talking about mechanical thrombectomy. Mechanical thrombectomy means we will mechanically remove the thrombus from the artery by surgical exploration. Craniectomy is also done. Administration of mentioned drugs, carotid endarterectomy, mechanical thrombectomy, craniectomy, these are the procedures that are adopted in patients with ischemic kind of brain stroke. Craniectomy is a surgical procedure where we remove part of the skull, part of the cranium, to relieve the intracranial pressure, to relieve if the patient experience any kind of headache, and the swelling that is seen in patients with craniectomy is relieved. Now talking about the management of hemorrhagic stroke. In patients with hemorrhagic stroke, neurosurgical interventions are adopted. Suppose if there is a bleeding hematoma formation in case of intracerebral hemorrhage or a subarachnoid hemorrhage, that is removed by surgery. Now talking about stroke rehabilitation. What is stroke rehabilitation? Stroke rehabilitation is a training program. It is a procedure where patients with varying kinds of disabilities, with cognitive disabilities, gait disabilities, if they are not able to speak properly, if they are not able to walk properly, if they are not able to sit, stand properly, if these kinds of disabilities are seen and are related to activities of daily living, these patients can have brain stroke. These patients should be considered for stroke rehabilitation. Now, first is talking about cognitive rehabilitation. So, cognitive rehabilitation means we are doing rehabilitation of cognitive processes in patients with stroke. For example, we will make them learn, relearn, and regain the abilities for cognitive rehabilitation. For example, if patient is not able to speak, we will use speech and language therapist in order to regain his speech, and through cognitive behavioral therapies we will help the patient to recover in time space continuum. Again, talking about simulation of automobile driving. So if patient is allowed to simulate the experience of automobile driving, his performance, his cognitive efficiencies will increase. So this kind of exercises or training programs will help patients to recover and regain the abilities, regain the power to drive automobiles. But stroke patients, in practical sense, they are not allowed to drive because they can meet with accidents. Now talking about yoga in these patients will increase their self-confidence, self-esteem levels, and it will enhance their endurance, stamina, both mental and physical stamina. But there are no evidences that yoga can be helping in alleviation of symptoms, but it is a type of training program which can be adopted in these patients for better recovery. Now, action observation is a type of training program which is adopted in patients with stroke. They are allowed to observe the procedures, and then they are allowed to imitate in order with intention to practice this task. Suppose they observe a person walking on a street on a computer screen, they are allowed to observe and they will imitate the person walking on the street, and in this way they will relearn and regain the process of walking, how a person can walk efficiently. Now, talking about cognitive deficits, if there is a deficit in concentration, memory, if they are not able to express their language properly, so these kinds of deficits can also be handled by through these training programs, which are different kinds of training programs, a set of training programs for their better recovery. There is another type of training program which is known as motor imagery gait rehabilitation. The word suggests that motor imagery gait rehabilitation means patients with stroke are imagined to walk and see the style of walking, and when they imagine the person to walk or see the style of walking without tensing their muscles, only imagining to walk, that will increase their cognition, and that can also help in walking. So patients with stroke must go for neuro-linguistic programming. There must be rewiring and reprogramming of the brain. Now, talking about physical and occupational therapy, this is also a one kind of training program where patients with brain stroke are encouraged for normal daily activities of daily living, and they are allowed to learn, like they are allowed to learn walking, speaking, standing, sitting, toileting, laughing. So maintaining these kinds of daily activities can be improved through this kind of rehabilitation program. There's one more type of rehabilitation program which is known as constraint induced movement. Constraint means we are using a sling on unaffected limb, and we are allowing the patient to pull that string by his affected limb, and this will improve his cognitive efficiencies, and he will have benefits over time